All right. Good morning, good afternoon, good evening. My name is Emmanuel Adegbola, and I'm so excited, fire up to welcome every one of us to today's show on Kina Ed Show. Today is going to be very fun, very entertaining, and of course, very resourceful. So I'm not alone on today's show. I have a lot of pharmacists professional right here in the studio with us. So we come with a lot of value for you. However, if you are connected to this show right now, the only way we can know that you are there is when you comment, when you ask questions, or when you contribute. So how to do that? If you're on Facebook, you will need to, permit Facebook to stream your comment. Also, if you are connected on YouTube, you can just like the video, subscribe to the YouTube channel, and of course, post your question over there. So today is going to be very, very fun, as I said. So without any further ado, we're going to get straight into it. I'm going to be bringing our guests to introduce themselves to you one after another, and we will get the party started. So I'm going to be starting, let me see. Let me start from Emmanuel. Over to you, Doctor. You go ahead and introduce yourself to our audience. Can you hear me? It looks like the line is frozen. Okay, so to make this a very, very smooth show, if you are not talking, just mute your line. Even among our panelists, please, just mute your line. So then when you are talking, you can now unmute yourself. So let's start. Ifeoma, can you hear me? Ifeoma, can you hear me? You are muted. You are muted. Can you unmute? Then you'll be able to. I know it's mute, unmute, mute, unmute, mute, unmute. Okay. So have you unmuted yourself? Not yet. Not yet. Can you unmute now? Okay. All right. That's cool. So go ahead and introduce yourself to our audience.
Okay. Pharmacist Ifeoma here in Nigeria.
Awesome. Good to see you. Can see you talking from motherland. All right. So let's come to US. We'll be shopping between the two continents. Obika, are you there? Can you hear me?
Yes, can you hear me?
Yes, awesome. You're looking sharp. So can you go ahead and introduce yourself to our audience?
Sure. My name is Obika Omenokor. I'm a staff pharmacist in Mineral Wells, Texas, and I'm glad to be here today.
Awesome, awesome. Today's show is for new generation. All right. So let's come back to US. Dr. Emmanuel, can you hear me now? Emmanuel Homer, can you hear me? Okay, so let's come back to, is this next part series? I like that name. So go ahead and introduce yourself to our viewers.
Hello everyone, my name is Pharmacist Leston Nemekalgu. I hold a degree in pharmacy and I currently practice as a community pharmacist in Nigeria. Thank you.
Awesome, awesome, awesome. So we're still waiting for who again? Okay, we've gotten Dr. Ifeoma, Dr. Bika, of course, Dr. Remind me of your name, but I can see next part. Okay, so let me bring in my co-host. My co-host will introduce us himself. Then we will all bring the host of today's show. Over to you, Mr. Alex. Go ahead and introduce yourself to our viewers.
Good evening, everybody. Good evening, good afternoon, depending on where you are. My name is Alex Wahiri. I'm a co-host of this program. Thank you very much and welcome.
Awesome, awesome, awesome. You are looking like one of the senators. I hope you will remember me in your kingdom. Looking so sharp as usual. Okay, then. Join me, ladies and gentlemen, to welcome the host herself of Kina Earth Show, Dr. Kina Omenekor. Over to you. You're muted.
Hello, everyone. Welcome to today's Kina Health Show. I am Kina Omenokor. I am a family nurse practitioner here in Dallas, Texas. I welcome all our audience from all over the world to this episode of Medication Madness. I'm sure some people will be wondering, what are they going to be talking about today? Today, we're going to focus on the critical role of the pharmacist, the role they play in the healthcare delivery system. Most of us know pharmacists as when you go to pick up your medication, they fill the medicines, you pick up your prescription, and then you go home. Medication administration is a vital component of the management of many ailments. And certainly, the role of a pharmacist does not begin or end with filling a prescription. So today, we are going to examine the scope of their duties and responsibilities with a view of highlighting how value to the patient, the healthcare system, and the well-being of individuals. So stay tuned and I hope you get something from today's show. Thank you.
Awesome, awesome, awesome. Thank you so much. So we are just going to get the party started, and I'm going to be handing over to my co-host, Mr. Alex. Over to you.
Dr. Emmanuel, I'm here to introduce himself so that we can move from there.
He said he has no sound.
Okay. Obika, let me start with you. Let us know who is a pharmacist and what's the primary duty of a pharmacist.
You are muted.
Unmute yourself.
Sure. So a pharmacist is a healthcare professional that is essentially the expert on the medications for the healthcare team. And what they do is they help ensure the quality of the prescriptions that patients are receiving, and they can help make sure that patients are getting the best therapy that those medications can bring to them. Whether it's in a pharmacy or at a hospital as part of a healthcare team, their duty is to ensure the quality of the medications and the medication therapy that patients are getting.
Okay. I want to get to our Nigerian counterparts. I want to start with Mr. Ogu, Pharmacist Ogu. The environment in Nigeria is a little bit quite different because in the pharmacist role there, you have some other people encroaching into it. Sometimes they answer chemists, sometimes they answer patent message dealers or sellers. So in Nigeria, what is the picture like? Is there any connection between what you people do and what those called patent medicine dealers and the chemists do by the roadside or in the markets?
Okay, thank you very much. Actually, there's a very big gap between pharmacists and patent medicine dealers. Pharmacists are actually healthcare professionals who are trained in the science and art of medications. They know everything about drugs, drug interactions, they resolve drug therapy problems, they stock all kinds of medications, be it OTC, prescription medications, and even controlled drugs. So they make sure patients get the right prescriptions given by the physician, making sure that there is no controversy in what the doctor prescribed. And patent medicine dealers, they are not professionals. They are individuals who only sell over-the-counter medications. They don't attend to prescriptions from doctors. They just sell over-the-counter medications like paracetamol and cold and cough medications. They know little or nothing about medications, drug interactions, drug traffic problems, adverse events. And another big difference is, if you want to identify a pharmacy, you look out for the ROS emblem, or you look out for a green cross in a white background. So in Nigeria, most average Nigerians, they still don't know that difference between a pharmacist and a patent medicine dealer. So this is a very big opportunity to, strike this difference. Pharmacists are healthcare professionals trained in the science and art of medications. They stock all kinds of medications, OTC, prescription drugs, and controlled drugs. And they solve patients' drug therapy problems. Thank you.
Yeah. Pharmacist Informer, I want to take you up. He said that Nameka said that the pharmacists sell, the patent medicine dealers and the roadside sellers sell out of the over-the-counter medications. But I know that perhaps that's what the law says. From your own experience, are they keeping to the letters of the law? Can you confirm that they just sell only over-the-counter medications? And then what are your observations?
Okay, am I okay?
Yeah, you should take off.
Is the duty of
Did you get my
Pharmacy
question?
Council of Nigeria. Okay, sorry, Pete. I just got little.
He said that the patent medicine dealers sell over-the-counter medications. And I am beginning to wonder whether, I know it looks like that is the law, but I'm wondering whether they really keep to the law, because I know that there are a lot of things that go on there. I'm saying from your own experience and from your observation, is it true that they just sell over-the-counter medication?
Okay, some of them don't really keep that law. Some of them might also not over-the-counter drugs. So they can equally sell narcotics, controlled drugs. I've seen some of them, they have sold controlled drugs. So it's the duty of the Pharmacy Council of Nigeria and NDLA to counter all these mishaps that comes up by patent medicine dealers.
Okay. So, has any other person anything to add?
Dr. Emmanuel, are you there? Okay. Dr. Emmanuel Omehe.
He's there, but he's having issue with his, I think, his sound.
Okay. All right.
Okay, do you have anything to?
No, I don't have anything to add to what they have said. I would like to ask the speaker, how do you collaborate with physicians apart from just filling the medications prescribed, for a patient? How else do you collaborate with doctors?
Sure. So there are many settings where pharmacists work closely with the prescribers and doctors to help make sure that patients are getting the best therapy that they can. For example, in a hospital, pharmacists work closely with the doctors, going to each patient's room and taking notes and letting the team know which medication might be causing an issue for the patient, or they can help decide on which medication would be best to take the next step to helping that patient to get healthy. So there's different settings where pharmacists can help the patient get better with whatever their situation is by giving their input as far as the different medications that are options for the patient and which ones might be optimal or which ones might be best for that patient's situation.
Thank you.
Even in the retail setting, pharmacists speak with doctors over the phone, and if they see that there might be an issue with the medication, they can clarify things with the doctor and help. They can communicate to make sure that whatever the patient is on, it's safe and effective for that patient.
All right, thank you. Dr. Nehe, are you with us?
His sound is not active.
Okay. All right. Mr. Alex, you can take up the next question.
Between the pharmacist and the doctor.
Can you start again? You are muted before.
Okay, I was saying that Dr. Vika's answer was quite good, very enlightening, because he tried to highlight the nexus between the doctor and the pharmacist. And I want to ask our Nigerian counterpart, does such a nexus exist? How do people liaise with the doctor to ensure that the patient gets the best medication available? Do the doctors give you the opportunity to liaise with them, discuss with them? Do you make inputs like Dr. Bika says in Nigeria? Pharmacist Ndemeka, I'm talking to you.
Okay, in Nigeria, the healthcare system is not as organized as that of friends in diaspora, US and precise. So there's a lot of also a lot of ego clash among healthcare professionals, especially
between pharmacists and doctors. So most times pharmacists don't, get that opportunity for them to, collaborate properly and determine the best medication for the patients. It's only few tertiary care centers that you can see cases of pharmacists and doctors participating in joint ward rounds. But in most other healthcare institutions, pharmacists don't usually get that opportunity. Doctors normally like restricting them to staying at one corner at the pharmacy to dispense drugs. But recently, I think some doctors, a good number of them, are beginning to understand that pharmacists possess, adequate knowledge. In fact, there is no professional that possesses knowledge on medications as much as the pharmacist does. So in Nigeria, some doctors, especially the ones that are not difficult, they give pharmacists the opportunity to, participate, in joint ward rounds with them and develop drug therapy plans and make decisions for the, optimum health care of the patient. So in Nigeria here is quite challenging for pharmacists, but I believe it will get better in the nearest future. Thank you.
Pharmacist Informa, I want to ask you if the role of the pharmacist in Nigeria is supposed to be attending, administering the medications prescribed by the doctor. But it appears too that sometimes some pharmacists go out of their way to do prescriptions, and at the same time, I don't know. So what is their boundary? Do you normally just limit yourself to administering what the doctor has prescribed, or do you is there any latitude? Is there any provision for you to even do prescription? Because I think some of them do prescribe and do treat. So would you want to comment on that?
Okay, let me use the community practice here in Nigeria as an example, because the community pharmacists here, they are more accessible compared to every other area of pharmacy practice. Like a patient will just walk into your pharmacy or a pharmacy shop, want a consultation by a pharmacist, maybe meet the pharmacist on duty, you explain yourself, the patient discuss his health issues or her health issues. Then you as a pharmacist, you try to develop professional relationship between you and your patient. Okay, let me not really digress from the question you just asked now. Maybe if a prescription is written by a doctor, do you mean if a prescription is written by a doctor and the patient comes with the prescription? Is that the question you asked, sir?
Yeah, well, do you limit yourself to giving out what the doctor has prescribed, or do you at times, as you have just started saying, when you establish that relationship with your patient, do you also eventually treat people who come to you with health issues? Do you have that latitude to treat them?
Of course. That's why you're a professional now. You have to treat.
Yeah, but is it lawful for you to treat? The doctor is treating, you are treating. I thought your role should have been to liaise with the doctor and administer the prescriptions made by the doctor. Are you saying you can also, as well also treat and prescribe?
Okay. You're talking about prescription here. Okay.
Yes.
In terms of prescription, maybe a patient came with a prescription, because the example I was given earlier was in community practice here. But let me just say, okay, a patient came with a prescription, and you go through the prescription, you assess the prescription. Of course, what you have to do mostly is just to see if there's any drug interaction first. If there's none, then you start your assessing. After assessing, then you start fishing out bringing out the drugs from the shelves. After you've done your assessment completely, then, well, in case where there is an interaction, maybe you don't really have access to the doctor, the number of the doctor that prescribed that medication, or probably, let's say, the patient might have access to the doctor's number, or maybe might not have access to the doctor's number. But in case where there is any drug-related problem, you actually have to get back to the doctor before changing any prescription.
Yeah, but I'm also asking, can you, on your own, when a patient comes to your pharmacy, can you prescribe and treat the patient, and he goes with the prescription? You give him a prescription, you treat him, and then give him medication. Do you do that? Is it allowed?
Yes, we do it. It's allowed.
It's allowed by the law?
You do it.
Okay. I know you do it. I know you do it. I know it is done. But I'm asking, is it lawful?
Okay. Is it lawful?
Yes.
Without a prescription? Okay, in case
no,
it's okay, let me ask.
Do you have the right as a pharmacist to treat people?
Yes.
Okay.
What you need, what you want to do, okay, a patient walking, because a pharmacy setting is like an emergency setting, okay, where a patient might just, and the person is sick, maybe complained of stomach bites, headache, and some other ailments. So it's your duty as a pharmacist that this person has come into the pharmacy premises. It's now my duty to make sure that the quality of life of that patient at the end of your consultation, and at the end of the treatment, that the person there should be an improvement.
Okay, let me
there
ask,
should be an improvement.
Let me just jump in. You know, you and I, and we all both know that things are not the way it's supposed to be in Nigeria. Like what Pharmacist Fioma is saying is what everybody is doing. But that everybody is doing it does not make it actually normal. You know, it's just like we had a foster kid, right, that we took to hospital just this last week, and this child, of course, has is on ventilator. I mean, is on vent. He has trach. He has G button. He has this. The nurse that's supposed to look at the G button will not go and be opening the boy's eyes. So it's different person that will look at the G button, the one side. It's another person that will look at the vent. It's another person that will do medication. It's another person that will transcribe medication. It's another. Everything is segmented here. But in Nigeria, it's a general practice, like what she's saying. And that is also one of the medical problems I think we are having in Nigeria. That's one of the medical problems I think we are having. So in a situation, I mean, for instance, I remember when I was living in Kaduna, we had a chemist. I did not study pharmacy. I'm not a pharmacist, but I could go to the market to buy paracetamol, buy Panadol. I know how to combine all those things together then. So when somebody comes for malaria, I already know which one I was going to give. And I'm not a doctor. And that is exactly why we're having this show, to be able to educate people. Why self-medication? Why do they do it? And what can be done to actually educate and to help our people? Is this making sense to us? I want to bring in Dr. Kina to kind of jump in also. I hope I'm on point here. Over to you.
Well, yeah, though we're discussing the roles of the pharmacist both here in the United States and in Nigeria today, and the rules and the laws obtainable in Nigeria are quite very different from here, where every guideline is stipulated and everybody follows their own lane. Here in the United States, I am believing that it's just very different from the Nigerian aspect. But the aim of the show today is to educate people what is important for them to know, how to make sure that they're getting correct prescription and an accurate treatment for their ailment. So it is important that you go to the doctor, make sure that you get a prescription. I was just going to ask, I think Dr. Mehe is back.
Before you ask, Dr. Kina, I see some comments on Facebook, so it's good we carry our audience also along.
Okay.
This is from Angel. Angel says pharmacists here in Nigeria prescribe, administer, they treat, and they also, they call all of them doctor. In fact, Nigeria call nurses doctor. As long as they can treat you, give you shots, they are doctors. So now, is this with the definition we give to pharmacists the earlier on? I'm going to be asking Obika, is this a definition of a pharmacist?
Emmanuel, let's give that Dr. Meher that question. Dr. Meher is actually a Nigerian trained pharmacist, and he practices both in Nigeria and the United States. I think he can shed a little more light on that question.
Okay, I hope
Dr. Meher, are you there?
Now. Go ahead.
I'm having connectivity issues here. Can you repeat the question? I can barely hear in and out. If I can hear the question very well, I will be able to. Like you said, I'm licensed both here and in Nigeria. I practice both here and in Nigeria, but I didn't hear the question very well. Can you repeat it, please?
The question is on Facebook. It's right there on the chart. Pharmacists in Nigeria prescribe, administer, treat, and they are all called doctors. Is that
normal?
Is that the law? The pharmacy body? Is that how they are supposed to practice?
Did you get it?
I still didn't get it.
Okay, it's right on the screen. It's right on the screen right here.
No,
Say pharmacists here in Nigeria prescribe, administer, treat, and
okay.
we call all of them doctors. Is that a right statement? Is that legal? Is that how it's supposed to be? Okay, I think we are having issue with the sound, so we need to move on so that we I'm still going to come back to Obika. Then Nigerians pharmacists also can defend themselves, because that is the importance and that is why we have this show. So to you, Dr. Obika, this statement right here, is that how it's supposed to be?
Okay, is it how it's supposed to be in Nigeria or America?
I mean, for pharmacists, that's how it's supposed to be.
For pharmacists, at least in America, yes, they have, in certain states, they have the right to prescribe, administer, and treat. But there's certain laws between the states, different states, that tell pharmacists exactly to what extent they can do each of those things.
Okay.
But yes, pharmacists can do those things in certain situations. Yes.
All right. Okay. Okay. So it doubt for me that this person is right. Okay, we can have some.
The laws that are prevalent in that state. Now let us go to medication abuse. So what do you mean by medication abuse? Dr. Mayhe, I don't know whether you are on now.
The sound is not happening.
Okay. Pharmacist in America, when we talk of medication abuse, what do we mean?
Abuse, actually, it talks about taking medications without prescription from the doctor, especially dangerous drugs. When people take those drugs, to get feelings of highness, excitation, outside, recommendations from a doctor or a competent healthcare provider, that is medication abuse. Thank you.
And how can it be checked? Can you make a suggestion? How do you think it can be checked?
Sorry?
How can it be controlled?
Okay, there are various ways through which medication abuse can be controlled. Like here in Nigeria, where the drug distribution chain is not in order. There is, this disordered or chaotic distribution system. Drug trafficking, Nigeria is being used as, a conduit wire for, bringing, pushing drugs to Europe from Asia and other places to Europe and North America. So there's this. So in order to check medication abuse, the system has to make sure professionals in collaboration with policymakers have to make sure that medications or all these dangerous drugs are in the right hands. Pharmacists are supposed to be the custodian of medications, but that is not the case in the Nigerian system. So when these drugs are made to be in the right hands, we can actually help to, we can actually checkmate or minimize medication abuse.
Okay.
Thank you.
Yeah.
Before, sorry, just to continue, Mr. Alex, we have some comments because we have to acknowledge our audience. Also, we have a Cynthia on Facebook. We have Jerry on Facebook. So Cynthia says a pharmacist can prescribe, treat, and administer, because we don't want to send mixed message to audience. We want them to know, okay, number one is the purpose of this show is not to point finger, is to help ourselves and to help our people and to be sure that we are doing what we're supposed to do. So, and just like what I said before, most of the it's just like when you go to school in Nigeria, you do everything, but over here it's totally different. You do what you're supposed to do. So, but like what this person is saying, Cynthia says a pharmacist can prescribe, treat, and administer medications in minor illnesses, as he or she is the most accessible member of the healthcare team. Good one, Kina Ed Show. Then we also have a Jerry. Jerry says this outing is a welcome development and will go a long way in addressing this problem. From information available to me, this is a common feature in most developing countries, Nigeria being one of them. Is all a function of poverty and a lack of relevant education and information. So that it's being done does not really make it right. And I hope somebody will watch this kind of show and also present this to the right channel in government. I still remember very well when I was in Kaduna. I tell you what, I used to sell medication and I was not a pharmacist. All I need to do is go to Central Market. My stepmom, she's a nurse and we are a chemist. And I know all sorts of medication I could buy and package them together and sold there. It is wrong. It is wrong. My mom was sick last year. She went to a nurse very close by, even though I know we are pharmacists here. The nurse gave her an injection. When I called my mom, I said, okay, what kind of injection did you get? And she didn't know. And I said, okay, ask the nurse that gave you the injection. When she asked, the nurse told her, you don't need to know the name. You don't need to worry about it. Just know that you will be all right. That also is wrong. And it's what people do. It's what is being done in Nigeria, and it shouldn't be like that. But I believe we just want to salute the grace of God over all of you practicing the pharmacists. You guys are doing a very, very wonderful job. But then your voices also can still be heard. Okay, you can let them know, okay, even though we are doing this thing, it doesn't make it that this is the normal thing for us to be doing. Well, let's continue as we continue writing this. Over to you, Mr. Alex.
Yeah, I wanted to ask Dr. Bika, what are the dangers of self-medication and medication abuse, and how do you think it can be contained, can be controlled?
So the dangers of self-medication or medication abuse is the safety of the patient. So if someone is taking a medication and they're taking it not how the doctor has prescribed it for them, they might not know how much is going to be too much for their body. They're not going to know if taking it a certain way can hurt them in the long run, or if we can make it so that the medication is not as effective as it can be. You might see this a lot with certain drugs like opioids, such as hydrocodone, and people, even when the doctor tells them how to take it, they might take it a different way. And in cases like that, it can be very dangerous and lead to long-term health problems or even possibly death. So those are the dangers of medication abuse. And as for how to control it, it comes down to the healthcare. It comes down to the individual and the healthcare team working together. So the doctor or the prescriber, they know what they're giving the patient. And then we're talking about pharmacists. So what the pharmacist can do is they can also see what the patient is taking, and if they can find clues to see if the patient is taking it differently than what the doctor might have said. So working together, they can use those clues and find a way to make sure the patient is using the drug the way that it should be used, and that way the patient can stay safe. But it's not always easy to do that. So a lot of it comes from being in contact with the patient, having communication with the patient so that you can monitor their therapy.
All right. Thank you so much for that information. We're going to continue that line, but we have a comment on YouTube. And that's from Udo Opara. Udo Opara is a pharmacist in the UK. Also have the opportunity to do an independent prescribing course to expand the cost of their practice to prescribing as well. It is becoming more and more common among us, to the point that it's soon going to be integrated into the university degree. So new pharmacists will have that prescribing functionality from the jump. That is from Udo, right? That's the comment on YouTube. Okay, we're talking about this medication abuse. Some people might not really understand what that means, because when I say abuse, if they say, okay, I abuse a child, maybe I beat my child or I flog my child where I'm supposed not to flog it. So is that what the medication abuse also means? Does that mean that I beat the medication, flog medication? So I would want us to kind of talk to a layman or a laywoman out there. So what does medication abuse actually mean? And can over-the-counter medication be abused? Anybody can take that up. Any of you can take that up. Can you hear me?
Okay. Medication abuse it can be as simple as not taking the medication how the doctor prescribed it.
Okay.
Whether it's intentional or not, that the term what we use is medication abuse.
Okay.
Or medication misuse.
Okay. Over to you, Mr. Alex.
Yeah, Nemeka, do you have anything to add in what Tobika has said? And I will also want you to address the issue of which are the medications that are commonly abused from your own experience, from your own angle. And how do you think we can contain it? How can we control it? How can we stop it?
Hello, can you hear me? I'd like to contribute on that.
Yes. Did you hear me, Nemeka?
Friend.
Did you hear me?
Okay.
Okay, I said medication abuse can also mean recommending a drug for your friend. You are not a medical doctor, but you think this drug can heal your friend's ailments, and you're recommending it for that friend. That is another instance of medication abuse. Also, taking drugs, especially the dangerous drugs, at high doses that are not, in line with the medical instruction given for those drugs. Then a lot of medications are being abused. In Nigeria here, a lot of I'm going to talk about the ones that mostly affect mental processes. Talking about that, the most commonly abused medication here is, let me talk about alcohol. Alcohol is highly abused in Nigeria because of its availability, widespread acceptability. There is no law, regulating it. So people tend to use it to give themselves this temporal feeling of, relief from anxiety and depression. and not knowing that it can actually, lead to addiction, alcoholism, and even more depression. Another class of medications that are being abused is the opioids. Talking about the narcotics like tramadol, a lot of young people here abuse tramadol. Some even players tell us, especially male tell us, it gives them this, outburst of energy. So they use it, continuously to, get energy for them to perform more effectively. Then codeine, other narcotics like dihydrocodeine, morphine, and others. Then I also talk about marijuana, like the cannabis. So it's highly abused both in rural, suburban, and developed areas. A lot of young people, they use it to, give themselves temporal relief from depression. Another class of medications that are being abused here is the stimulants, like the amphetamines. These drugs medically, are used in treating ADHD, but people outside that use it, to give themselves feelings of excitation and, happiness, euphoria, without considering. Some of them are even ignorant. A lot of them, they're ignorant of the, life-threatening side effects of these medications. Then OTC medications like pen medications, especially the NSAIDs, they're highly abused. People go to pattern medicine dealers, complain of pains. They can even recommend different painkillers from different, classes in the same family for them to take. Then cough preparations containing codeine, um, dextromethorphan, diphenhydramine. It gives them this, excitatory feeling. So sometimes they buy all those cough medications, to get that feeling. So these are examples of medications that are commonly abused in Nigeria here. Thank you.
Thank you so much. We have a question from Facebook, and the question says, I think from Angel. See, most of the time in Nigeria, we miss our dose. What do we do when this happens? I think it's an abuse. So what can be done in this situation? When, of course, it's just when they miss their dose. I mean, the question is not really comprehensive enough, but I believe what it means is that, okay, let's say, for instance, you're supposed to take a medication, let's say 3 times. You take it either one time, you feel good, or you feel that, okay, you are getting better, and you miss the remaining one. Then maybe like 2-3 days, the same situation comes back. So what can be done in this kind of situation?
Okay, in this kind of situation, when you miss a particular dose of medication, what you do is, as soon as you remember that you've missed a particular dose, you take the next dose as soon as you remember that you have missed your previous dose, but you don't double dose. Assuming you're taking the medication at 12-hourly interval and you remember you've missed the dose, when you take that dose you have missed, you have to wait for another 12 hours for you to take the next dose. And missing a dose while you're on medication, it falls under medication misuse. In this case, you are going outside, the instruction given on that medication by your healthcare professional. Thank you.
Yeah, before you go, you were talking of medication abuse, and from what you said sometimes if people don't take the prescription, either they take an underdose or overdose, is medication abuse. And that takes us to the issue of the use of herbs in treatment. Now, people who use herbs in treatment, I don't know how they manage the doses. I don't know whether there are measures are being taken to be able to supervise what they're doing, because experience has shown that that area is prone to medication abuse. What is your comment? What is your reaction?
From time immemorial, some herbs have proven to be beneficial to health. But at the same time, a lot of herbs are being abused, most especially in Africa, where the information on herbs, is being passed down to the next generation through oral tradition. A lot of herbs, there are no documentaries, they are not properly documented. It's just orally transmitted from one person to another. If you go to streets, marketplaces, parks, open markets, you see a lot of adverts on herbs, unapproved herbs that have not been, assessed by regulatory bodies, both local and international. So a lot of people abuse all these herbs because of lack of proper documentations. They don't have a definite dosage. So people tend to take it, the way they like. And you find out that with time, most of them come down with a lot of adverse effects. Even drug interaction, some we take it alongside synthetic medications, which is very dangerous to health. Even most of those herbs, also, when you look at the quality, they are also filled with contaminants, heavy metals. So that can also be detrimental to health. Also on the individual, some individuals genetically react to some components of those herbs. So this is a problem too. So it becomes complex and difficult for you to determine what you're allergic to in that herbal preparation and what you're not allergic to. So generally, herbs have proven to be beneficial, but at the same time, there has to be proper research and documentation on those herbs. And I encourage people to go for herbs that are being approved by local and international regulatory authorities. Thank you.
So what you are saying is that there are some apps that that are being approved. So now I also noticed that most of Nigerians, when I say Nigeria, I mean talking about Africans, apps like all these medically traditional prepared herbs. They don't really have a dosage. You can just take it as you go, and as long as you get well, you'll be okay. So what can you say to that situation? How can that, because most of the time it's not, maybe all these things don't work, right? They really, really work. Just like with the way we have a woman, they cook, but there's nothing like recipe. And that is why you can give two women the same ingredient and the soup will taste differently because there's no recipe. So like all these apps, all these traditional apps, that is there any way that is there any advice you can give? Possibly somebody might be watching that can help them in packaging it and possibly make it something that can be measurable.
Okay. In Nigeria, everybody wants to play a role in healthcare. Everybody wants to be a drug seller. So a lot of people, they will go and prepare any kind of concoction they like, and project it or display it in the market for people to buy. So the best thing is pharmacists, being researchers as well, they need to look into, especially those ones in industry and research, look into these herbs, check those ingredients or contents that make them therapeutic and which quantity are they therapeutic, because there is a particular quantity at which they are no longer therapeutic, they are now toxic. And also through research, those therapeutic ingredients can be separated from the poisonous ones, because most of these herbal preparations, they contain up to a lot of molecules, both the therapeutic ones and the poisonous ones. So when it comes to herbal medicine, it's a very complex area, and there has to be well improved research on that area. And people are advised to, for those ones that have been researched on, that is the ones I encourage them to go for and follow the recommendations or instructions given. Thank you.
Right. Well, I know our time is fast spent. We have about 5 more minutes, but we still have some things that possibly we need to touch. Personally, I noticed that, okay, for instance, and this question is going to Obika. I noticed that there are some questions that, there are some medications that are liquid, but when the pharmacist send those medications out, it's showing tablets, right? Like, okay, give 1 tablet per whatever. But this medication is actually liquid, but they give it out, they deliver it they deliver it in liquid, but when the order is coming or the order that is written on the bottle is showing tablet. So whose fault is that? Is it the pharmacist or the doctor? Because when you are talking about the medication right, you have the right medication, the right route, right time and frequency, right patient, and right dose. So, but now in this case, now we're talking about the right route. I even like in situation you will see medication is supposed to be given through, let's say, G button, because I have a child that have a G button, but they will still say give by mouth. But this person doesn't even take anything by mouth. So who made that mistake? Is it the doctor that prescribed that or the pharmacist? Over to you, Obika. And I can see your mom just getting ready to support you if you. So go ahead.
Sure. So if you're saying if you get a medication and what it says on there doesn't
tally with how it's supposed to go. For instance, the medication comes in liquid, but right on the body is showing give 1 tab. Meanwhile, this is not tablets, this is liquid. So whose fault is that? Is it the doctor or the pharmacist?
That could have happened either because of the pharmacy or the doctor. If the doctor,
I know it's one of them. So whose fault is that? Because it's what I see every time.
Because if the pharmacy will be the last person to see the prescription before it gets to the patient. So it could be that the pharmacy, they wrote it how the doctor sent it to them, or they didn't know that the patient has a G button, or the patient, or they realized that they did not realize that even though it's a liquid, they're still leaving it as tablet on the instructions. So you can say that it's the pharmacy's fault because they were the last ones to see that before it got to the patient. But that does happen sometimes. We encourage the patient to call the pharmacy or the doctor when they notice things like that, because sometimes that happens.
Right. Okay. I see Dr. Kina wants to add something because I just keep saying smiling and smiling as you are talking. You are muted. Okay.
Well, like you said, sometimes there could be a typographical error or a mistake either from the doctor's point, that like he said, the pharmacist is the last port of call before it gets to the patient. So, such mistakes, should be identified and, and corrected. You were saying earlier about a patient having a fake tube or a G button, and yet they send the medication as a tablet. At the pharmacy point, I think they have a limited information on the condition of the patient. I don't think that's always included in their prescription. So they would naturally just fill the prescription the way that the doctor writes it out. But again, like you said, if there's any discrepancy in the route, dosage, or any part of the medication issue, always get with your provider or contact the pharmacy, and they will always get it corrected.
Awesome, awesome. Well, I thank you so much for that response, Dr. Baker. All our crew from Nigeria, thank you so much. We are tidying it up right now. It's been a very, very resourceful show, and Pharmacist Emmanuel, we couldn't hear anything from you. I hope next time you'll be able to rectify whatever the problem is, and then we get to have, hear your view very well. But before we close for today, is there anything you would like to maybe like I normally like it like a take home for our viewers, Dr. Baker?
Yes, so I think that the biggest point of the conversation is to understand that pharmacists are there for the patient. They're very accessible, and patients should feel free to see that pharmacists have a lot of knowledge about the medications they're taking, and they shouldn't be afraid to ask questions to the pharmacist or share any issues they're having with their medication with the pharmacist so that they can get good guidance and help for their therapy, because a pharmacist speaks with the doctors and the patient. So keeping that open communication is what I recommend for patients.
Awesome, awesome. And over to my co-host, what would you say your take home is, or something that you want to pass across to our audience? That, okay, this is what I expect you to go home with.
Well, everybody should watch medication abuse because it is very dangerous. It is the cause of so many illnesses, so many breakdown of the body system, and people should try to obey the rules. Thank you.
Yeah, even ordinary cough medication, people abuse it because they know that once they take it, it's going to make them sleep, and before you know it, you just get addicted to it. So, yeah, medication abuse can come in any way, Anyway, it's been a great pleasure, and Dr. Emmanuel, we are so glad that we have your pictures, even though we couldn't really hear your voice, and we are so happy to see you. So once again, it's just been a great delight. My name is Emmanuel Adegbola, and over to you, Dr. Kina, as to round off today's show.
All our viewers, thank you all the panelists that joined us in this show today. It was a great presentation. There were several areas that we did not touch, so maybe we will have episode 2 on this show. I want everyone to understand that the herbs you take, certain tea, your supplements, your over-the-counter, all of those could be abused, and realize that all of those also can interact with certain medications that you are taking. It can either potentiate the effects of the medications or lower the effect of it. So it is important that you always check with your healthcare provider, and the pharmacists are there to guide you to make sure that the medications that you're taking are safe, and that if there are any issues with them, they will consult with your doctor to make sure that you're getting the best care. I want to thank everybody for joining us on today's show, and we will see you all in the next 2 weeks. Bye.